There is an extremely high degree of information and knowledge asymmetry between the doctor and the patient and between the doctor and the insurer. We want to briefly examine the issue of doctors and their attitudes towards economics and how this affects my confidence and trust in doctors and in hospital systems. We will also briefly talk about the issue of medical malpractice and how doctors can dodge lawsuits. So coming back to this knowledge asymmetry, because this is a complex subject and because the consequences are irreversible of a decision that we take, this knowledge asymmetry between that the doctor has an advantage over could be used or allows the doctor to manipulate the relationship, the medical relationship between either with the patient or the insurer. There is this idea in microeconomics or this concept called induced demand. So what happens in a relationship between the doctor and the patient is that the doctor translates the patient's medical condition, demand, into a series of prescriptions, diagnostics, treatments, medical care plan, consumption or supply, right? So the doctor, in a sense, is both the producer and the consumer. And this gives the doctor extraordinary power to manipulate a relationship. Despite all the advances in technology and the availability of online AI tools, patients and consumers like us will always remain uncertain and hope that the doctor does the right thing. And we cannot generally protect ourselves from a poor quality of diagnosis, poor diagnosis and poor quality of care treatment and design plans. Healthcare is a social good, as Kenneth Arrow said, and the existence of social obligations prevents the doctor from behaving like an overeager car dealer salesman person, if you will. But can we continue to count on this innate goodness of doctors, where it is the patient's well-being that provides the doctor his or her ultimate satisfaction and happiness? We know that most of the doctors are part of a fee-for-service, a dominant fee-for-service healthcare system. In emerging markets, it is mostly private. And we know that in most of these private fee-for-service healthcare systems that are listed in public stock exchanges, all the rhetoric aside, shareholder was, and will probably always be the king. And their interests will always be dominant, and every other interest would eventually be subservient. So what safety nets do patients like you and I have in a situation like this, that the doctor, because of this induced demand idea, where the doctor is the consumer and the provider, the person who creates the demand and also provides the supply, how can we protect ourselves against this asymmetry? And this is where I wanted to examine a few studies to give us a glimpse of what are the doctors' attitudes in general towards economics. And then we will look at the rise of medical malpractices and lawsuits against doctors, and what can doctors do